Hello, my name is Rebecca Guitron. I am a nursing student at Indiana State University. This video will be about chronic traumatic encephalopathy in regards to a community health nursing course, Nursing 444. Learning objectives. The learner will define what chronic traumatic encephalopathy is, also known as CTE. The learner will recall the activities and sports commonly associated with CTE. The learner will identify symptoms of CTE, and the learner will explain the causes of CTE. At this time, please pause this video to take the pretest, which is located below in the description box under a link. When you are finished with the pretest, you may continue with this video. Thank you. What is chronic traumatic encephalopathy? CTE is a degenerative disease that affects the brain and is caused by repeated head traumas. Symptoms usually begin many months or even years after the repeated head impacts. The degenerative changes to the brain continue to occur throughout one's life. These changes affect how a person behaves, thinks, and moves. The populations at risk for CTE include people who have been exposed to repeated and multiple head traumas, military veterans, victims of intimate partner violence, and most notoriously, contact sport athletes. Many sports that are involved in this are football, rugby, hockey, boxing, fighting, MMA, pro wrestling, motocross, dirt biking and ATV sports, soccer, downhill skiing, extreme sports, really any sport where the athlete may be subjected to head impact. So the above sports are not the only ones that may contribute to CTE cases. In fact, there are many other sports and activities that are associated with CTE or multiple head injuries. Football, hockey, soccer, bicycling, basketball, and rugby are a few sports that have the highest incidence of CTE victims. The causes of chronic traumatic encephalopathy include repeated blows to the head, also known as subconcussive head impacts. Subconcussive head impacts do not cause symptoms, and also traumatic brain injuries is another cause of the CTE. Symptoms are present with concussions, which is a type of a traumatic brain injury. Common mood and behavior symptoms of CTE are aggression, depression and anxiety, mood swings, paranoia, impulsivity, erratic behavior, insomnia, personality changes, as well as increased suicide risks. The symptoms of CTE may affect daily living and activities, impeding on work, life, social relationships, and daily tasks of the victim. Cognitive symptoms of chronic traumatic encephalopathy include memory loss, usually short-term, but not limited to, confusion, impaired judgment, dementia, thinking problems such as brain fog and trouble focusing. Common physical symptoms of chronic traumatic encephalopathy include movement, any subtle or drastic changes in the way a person moves his or her body, troubles with balance and coordination. Physical symptoms of CTE have been compared to those of Parkinson's and Alzheimer's sufferers. Chronic traumatic encephalopathy is surrounded by ethical dilemmas. For instance, CTE can only be diagnosed after death, leaving the CTE sufferers and their families in the dark about the degenerative disease. Despite the incidence of CTE in contact sports are still very common around the world. There is little to no screening criteria for athletes of contact sports and CTE. Many athletes continue to play sports without knowing the risks of the contact sports. This puts themselves and others at risk of harm due to CTE symptoms. There are some ways that the ethical problems surrounding chronic traumatic encephalopathy can be resolved. To help clear the confusion surrounding CTE, athletes must be educated on CTE, provided with information regarding their individual risk associated with the sport, with emphasis on the younger population. Sport teams and organizations need to hold themselves accountable for chronic traumatic encephalopathy related cases. Concussions amongst the athletes need to be recorded and documented, and the individual player needs to be assessed for risk factors of CTE. Youth sports need to consider modifying current player practices to lessen the risk of repeated head injuries during the sport. For example, a youth contact football program might consider flag football or some type of touch tag football as opposed to tackling. Soccer associations can outlaw side tackling, which is a big factor in increasing physical harm and head trauma in soccer. Each and every athlete of a contact sport needs free access to medical staff and trainers provided by the sports team themselves who are efficiently trained on CTE symptoms. Any player who exhibits symptoms of concussion should be properly screened and highly considered for removal, as to prevent any repeated head traumas. These are the references used in the making of this video. Please use them as resources regarding CTE. These resources are the pioneers of CTE research and medical knowledge. They include Alzheimer's Association, Brain Injury Research Institute, BIRI, Centers for Disease Control and Prevention, the CDC, as well as the Concussion Legacy Foundation. Please take the POTS test now, which is located below in the description box below this video, as well as please check out the handout, which is included also in the description box under a link. Thank you for watching this video, and I will see you next time.